The state budget is due already on Monday, but 3 days before that deadline, a battle over health care access for undocumented immigrants is now really complicating negotiations. Here's our Danny Spiewak with the latest from the Capitol.
One day after legislative leaders announced a budget framework,
this is unacceptable.
A coalition of faith, labor, and immigrant rights groups rallied outside House chambers to oppose a budget provision that would end state-funded health care for undocumented adults.
This moment is about undocumented brothers and sisters.
With a tie in the House this year, Republicans prioritized rolling back a DFL law that made undocumented immigrants eligible for the program known as Minnesota Care.
It's not a measure of being uncaring, it's a fiscal issue.
According to the Department of Human Services, more than 20,000 undocumented people have enrolled in Minnesota Care in this first year of eligibility, totaling $3.9 million in paid claims. DHS says that's more people enrolled than expected, although the amount spent per person is lower than expected.
Those that are here illegally, they can still join the private market, so it's not that healthcare is being denied in any way.
In a compromise, Governor Walz and DFL leadership agreed to strip Minnesota Care access for undocumented adults, as long as Republicans would agree to preserve access for children, who make up 24% of current enrollees.
This will change people's lives, in some cases substantially for the worse, but it is a compromise, and under the compromise, we will be funding state government in the state of Minnesota.
But a number of DFL lawmakers say they won't vote for any budget bill that includes the compromise.
Take a deal that meets the dignity of Minnesotans.
In the final days of the session, this issue is likely to come up in the Health and Human Services bill. But the conference committee between the House and Senate that will finalize that legislation has not yet met. At the Capitol, I'm Danny Spiewak, KARE 11 News.